Hello, we are Team 6 and we are presenting Dexcom G6 continuous glucose monitoring device created by Dexcom. My name is Neela Rafiq and my teammates are Sarah Bamani, Ferris Hoosh, Jeannie Johnson, and David Lin. Next slide. Diabetes is a metabolic disease with a prevalence of 463 million people and expected to rise to 700 million by the year 2045. The overall expenditure for diabetes was $760 billion in 2019. Next slide. Let's discuss the history of Dexcom. In 1999, Dexcom was launched, but the actual work for continuous glucose monitoring, also known as CGM, started in the late 1960s. In 2005, Dexcom announced the initial public offering. In 2007, Dexcom launched the 7 CGM system, and it was approved for up to 7 days of continual use. In 2012, Dexcom acquired Sweet Spot Diabetes Care to advance its technology platform. In 2017, the Dexcom G5 was approved by CMS. And in 2018, the Dexcom G6 was approved by the FDA for both type 1 and type 2 diabetics ages 2 and up. And it was used as both as a standalone CGM and for integration with insulin pumps. Next slide. The Dexcom G6 CGM has 3 parts, consisting of an applicator, sensor with transmitter, and device. First, a tiny sensor wire is inserted under the patient's skin using an automatic applicator that lasts for 10 days. The transmitter sends real-time data wirelessly to their device every 5 minutes. They receive updates and alerts, and they also have a Follow Me app where patients can notify up to 5 people of their blood sugar readings, including their physicians. And this is important for patients who are hypoglycemia unaware, meaning they do not even know when their blood sugars are low. With the Dexcom G6 CGM device, patients no longer have to check their finger sticks and can proactively manage their diabetes. I'm going to pass this over to Jeannie.
Thank you so much. So I'm going to talk a little bit about the business model for Dexcom G6, including the competition, some elements of the market size, stakeholders, value, and revenue. To start, the Dexcom G6 has been rapidly adapted by the diabetics community due to its innovative and continuous glucose monitoring system. The target market includes insulin-dependent diabetes patients versus non-insulin-dependent diabetes patients, endocrinologists or specialists in diabetes treatment. The Dexcom G6 has obviously capitalized on the pandemic outbreak in that it's been accelerated and more wider used versus the self-monitoring devices, because this is the Dexcom is a lab-at-home glucose meter, which helps in infection-related fears. The 2 most popular continuous glucose monitors available at this point in time in the United States as of spring 2021 include Dexcom G6 and Abbott's Freestyle Libre. Next slide, please, David. So when we take a look at these two competitors, and we can see that with the Freestyle Libre, there is less accurate mean absolute relative difference scores. The Freestyle Libre scores a 9.2% for adults, 9.7 for children, and we want a lower rating in that for accuracy's sake clinically. Also, the Freestyle Libre includes no mobile app as it's under FDA review, so users must have a handheld reader in order to utilize the device. And it's also not compatible with other diabetes devices where Dexcom G6 is. One of the major challenges for Dexcom includes to maintain revenue, may include competition with Medtronic, the MiniMed 640G insulin pump, which is the first system that's really closed the loop in that it includes both glucose monitoring and the delivery of glucose in patients. So there still is not that need for a finger stick or a finger draw, which removes blood. In order to compete, however, the Dexcom has collaborated with Tandem, which is a product that does allow for when they have a glucose or an insulin reading, they're able to also provide for the delivery of insulin. So in collaboration, it sort of meets that requirement and continues to be the gold standard as far as care is concerned. Dexcom G6 uses e-commerce to generate nearly 70% of sales and continues to thrive in this market. I'm going to hand it over to Ferris.
Thank you so much, Jeannie. Dexcom received their first FDA approval for their CGM technology in 2006 and the CE clearance shortly after. They have been the market leaders for decades through multiple strategies. Since the first short-term sensor to the much anticipated G7 sensor, they have been pushing the envelope to improve their product's performance and keep a strong innovative pipeline to remain in the lead by purchasing companies or partnering with technology giants like Google, Apple, and Fitbit. They kept their platform open for other developers, making it easy to integrate their technology with other medical devices and apps. They have also worked with regulators and the CMS to get approved for patients with type 1 as well as type 2 diabetes, aiming to become the standard of care for CGM. With the effect of the COVID-19 pandemic on the healthcare industry, Dexcom explored the remote home care market, as well as glucose monitoring for patients who are quarantined at home or in hospitals, helping to minimize the spread of the infection. Finally, they have expanded their advertisement campaign significantly, emphasizing the ease of use and value of their devices through famous athletes like Peloton instructor Robin Arzon and superstar Nick Jones, who delivered an amazing ad during the much anticipated Super Bowl 55 back in February. I will pass it now to David.
Thank you, Ferris. So Dexcom's strategy apparently pays well. Its growth has been phenomenal. In the past 3 years alone, Dexcom's revenue growth has been consistently about 30% from 2018 to 2020. Compared to globally, the GCM market growth in the past 2 years has been staying around. It's been projected in the next 5 years to be about 6.5%. Dexcom global market share also increases from 2019 at 40% to now 49% in 2020. And as mentioned above, that COVID-19 also further opened up another market to increase the remote patient monitoring due to the need of minimizing human traffic to the patient's room and also reduce the patient's exposure. Now I'll pass on to Sarah.
Thank you, David. There are many limitations and barriers to the continuous glucose monitoring system, from technical, user safety, and cost-related concerns. The first and foremost biggest limitation is price. Prices range from $60 to approximately $330 a month, not accounting for subscriptions, add-on devices, placements, and insurance coverage. Replacing system components or sensors and added physician visits can add up expenses significantly. The second area of improvement would be to tackle the lack in awareness for the differing levels of literacy and numeracy. Not all diabetes diagnosed patients are tech savvy or understand the challenging route paved for them through the new adaptive system. Incorporating a training program where families can gather to learn would also be helpful guidance to understand the device as a whole. CGM is currently covered under private insurances and recently became covered under Medicare for those 65 or older. However, diabetes patients type 1 and 2 are diagnosed in all ages. Coverage for those who may fall in the less fortunate category poses ethical, financial, physical, and emotional dilemmas. Next slide, please. There are many recommendations offered to the continuous glucose monitoring system, such as decreasing costs to ensure affordability, connection to all demographics, and overall sensitivity to diabetes. Using refurbished devices can allow for better research and cost savings. Physician and patient trainings by CGM reps can ensure understanding and health literacy for all age groups. Direct-to-consumer marketing allow for CGMs to get their word out there. With such a new trend and way to remote patient monitor, explaining through media and to consumers or patients would be a great approach and strategy to gain trust for the brand. Lastly, since the innovation is new, working on updates in the system, indications, and proper transfer of health records could be useful to Dexcom. Overall, overcoming and optimizing these issues require collaboration on all ends, from stakeholders to potential competitors, as well as patient and physician partnership. Thank you for your time.